amazing people. Welcome to another amazing time. My name is Faith Gavin and this is ComfortTV.channel. Welcome to the premiere edition of our talk show on health. This is called Inside Health, where we're going to be talking about topics surrounding health, demystifying the most complex health terms and making sure that you and your friends and every other person watching us are conversant with every other health topic so that you know how to best take care of yourself and what to do in case of a health situation. Welcome on the show today. Yes, I call it the show that can help save your life. So please give our videos a like, subscribe to our channel, hit the notification bell so that you don't miss out on future episodes of Inside Health. My name is Faith Gavin and I've got someone amazing here with me. Her name is Nurse Ijeoma Uche. Hello, Nurse.
Hi, I'm very happy to be here. I'm thrilled to be here. Thank you very much for having me.
Yeah, and we're thrilled to have you. Thank you for honoring our invitation.
Thank you very much. Thank you.
Yes, so I chose Nurse Uche here because she particularly is almost on the front lines of healthcare every other single day. Yeah, she takes care of patients, and I feel she has experience both in the hospital and in community health settings. So I think she's the best person to, talk to us today on our topic, something very important. So we're going to start at the very beginning. On today's episode of Inside Health, we want to talk about blood pressure. Yes, we want to talk about blood pressure and ways that you can know if you are at risk or not. In this part of our world, when people hear blood pressure, the next thing they go is, God forbid, it's not my portion, and all of that. But we both know, everyone knows, that when you are educated, when you are informed, it kind of gives you an edge. And that's what Inside Health strives to do. So welcome to Inside Health again. Anyways, I'm moving straight into what we have for you. A lot of people hear blood pressure, but they don't understand what it means. So I just want you, Nurse Ijeoma Uche, to explain in the most simplest of terms, like you're speaking to a layman, what exactly is blood pressure?
Okay, thank you very much. Thank you once again for having me. Blood pressure, that everybody has been saying about blood pressure. Now, another name for blood pressure is hypertension, which everybody knows. Then this is kind of, we can say is a persistence evaluation of your blood pressure in your arteries. That's like your blood pressure, your blood is pumping very fast in your arteries. That's just the in layman's what we can say what blood pressure is.
More like, are you saying to what extent the blood pumps?
Yes, like very fast. Now it depends. Now the normal range for blood pressure, as we all know, is 120. That's where everybody knows, 120/80. But blood pressure has pre-hypertension. Then we have stage 1, we have stage 2, we have stage 3. Then we also have the emergency one, which is the hypertensive crisis.
All right, I think we need to be clear on this. The blood pressure is how fast or how slow the blood pumps, right?
Yes.
Then hypertension is a case of where the blood is pumping too fast. Okay.
Yes.
What if it's pumping too slow? Is there a name for that?
Yes, hypotension.
Hypotension.
Yes.
All right. So first of all, she mentioned two numbers, 120/80.
Yes.
And I told her that as far as I'm concerned, 120/80 is an improper fraction. But as regards to health, what does it mean?
Okay, that's the normal range for how the heart is meant to be pumping. Like the heart is meant to be in a range of 120. It depends on how the heart beats, because the hypertension that we're talking about has to do with the cardiac, which is the heart. Now it depends on how the heart is being pumped. So normal range that the heart is meant to be pumped is 120/80. Now, when we say that something is emergency now is when it's up to 180. Now, for pre-hypertension should be the range of 130. Then we have the stage 1. Stage 1 is 140. Then stage 2. Now we have this systolic and the diastolic, which is the 120 is the systolic, then with the 80 is the diastolic.
more like the numerator and the denominator.
Yes.
Sorry, I'm going towards the mathematics side.
Yeah.
Okay, but a lot of people have a general term for hypertension. They always say the silent killer, the silent killer. Why do they give it that term? Why is it called the silent killer?
Okay, they call it the silent killer because sometimes you don't see the signs and symptoms when you are having the crisis. Mm-hmm. There are some persons that doesn't have their symptoms. Like there are some symptoms that comes with headache, dizziness, but we call it the silent killer because it doesn't have any symptoms. So it might just come. Like let's say for example, hypertension is divided into two. Okay. Now we have the primary and the secondary. Now the primary is mainly the silent killer. Reason because it doesn't have any signs and symptoms, so it can be genetic. So it might be obesity. So we can't say this is a particular thing that is just causing it. There are some persons that, because the secondary is when you have a disease condition like the CKD, that's a chronic kidney disease, diabetes mellitus, and so on. So that's why we call it a silent killer, because most times you don't see the symptoms, it just comes. And you see that somebody will just faint. The person will be like, I was just here doing something. We were just talking and the person just slumped. Just like that, sir.
Well, anyway, since it's the silent killer and we know that we really need to know what we're dealing with. We don't want to be taking unawares. But in the range of human beings, like people, who do you think is more at risk? Who are the people who are more at risk of developing hypertension? Okay, the people that are more at risk to develop hypertension are one, the obese. Yes, the obese. Then one that can't manage their stress level. Okay. Yes, you're at risk of getting it. Then some disease conditions. There are some persons that has kidney failure, kidney disease. They're at risk of getting it. Another thing is pregnancy. Yeah, there are some pregnant women ends up they were never hypertensive, but once they takes in, they are hyper. Yes. Oh, that's another topic for another day, because I was going to ask like how in fact. All right. So yeah. So if you your age is a factor. Yes. Your weight. Yes. But the kind of things you eat also make you hypertensive. Yes. Some things that we eat, more especially there are some that when they are eaten, they tend on taking too much salt. So that's why most times when people are hypertensive, we normally advise them to reduce their intake of salt. Yes, we advise them, and we need to be exercising regularly. When I mean regularly, so that it can reduce the risk of having hypertension. All right. So since we mentioned the age factor, I know a lot of old people are the ones with the. But is there any? Have we situations where young people develop hypertension? Yes. Yes, because nowadays, I think it was before that we know that when we mention hypertension, we look at the old people, we look at the elderly people. Yeah. But right now, we end up seeing that the young people, now that's why I brought in the genetic. Now the genetic is that it comes from the father to the children, or the mother to the children. Now it's no longer that it's medically that this thing medically caused. Yes. So now it's something that we don't know that this particular person is going to, like most times you go to the hospital, they will tell you, okay, I'll check your blood pressure. Your blood pressure is very high. Then you will like, the person will ask you, what caused it? Do you have any relative that has this? Yeah, so you might say, yes, my mom is hypertensive or my dad. So most times that's how, that's the result why the younger generation, and also excessive alcohol intake, because nowadays, okay, here we go. People in their 20s, people in their 30s say I'm hypertensive, and I'm looking at them like, the idea for us is they have problems, they have psychological problems, they're thinking too much. No, thinking is, it's not even related. Yes, it's not. All right, but so I know we're excluding the fact that there aren't almost any symptoms, but I think you can still point out some really slight ones. Yes, some of the symptoms that we know as headaches, more especially in the morning at the occipital if you region. Wake up with a headache. Yes. Wow. Then dizziness. Okay. Yes, dizziness can be. Then most times stress.
You understand, Ken?
All right. In that case, almost everyone should be hypertensive because we live a lifestyle of stress.
Yes, that's where we need to manage our stress level.
Oh, okay.
Yes, we need to manage our stress level.
In other words, don't take on too much.
Don't take on too much, and try as much as you can to drink a lot of water and sleep well.
I'm taking notes. All right, but have you personally seen patients come into your medical space where you work totally unaware that they had high blood pressure?
Yes. Actually, that was last week. I went for a medical outreach. Then a girl of, I think, what was her age, 26, she came. But her blood pressure was reading 160/100. And she didn't know about it. So what we did was to advise her to some necessary drugs that she's meant to take and advise her to keep on checking her blood pressure regularly. So we advise everybody, keep on checking your blood pressure.
The next usual question will be, Auntie, what are you thinking about? What is bothering you this much? But she's just an average young lady and she's hypertensive and didn't even know.
And she didn't even know.
Well, let's say someone watching us right now from across the screen and is saying, do I have blood pressure? What should they do?
They should go and check their blood pressure.
Point blank.
Yes. Check. Go and check. Go to the hospital. Go to the health centers. Actually, it's free now in health centers.
But what's the process? Some of us are afraid of needles.
No, it's not needle. Just use your swig, and it's just something they call just your sphygmomanometer and your stethoscope. The nurse practitioner will have to check to see if your blood pressure is high.
I've seen that done. They put something around your arm. And press and stuff.
Yes.
Okay, but these home monitors you mentioned, you said you could do it at home. How accurate are they?
Yes, it's accurate.
So you think people should trust the home monitors?
Yes, you can trust it.
All right. Anyways, you heard it from Nurse Ijeoma. Let's remind you again that this is Inside Health on Comfort TV, the channel. If you are getting value from this video, you're learning so much, drop a like for this video. Give us a comment if you have questions for our health practitioner here. And also remember to subscribe to our channel. Hit the notification bell so that you don't miss out on future episodes. Yes, so we're going to move on to the next agenda, but she just wrapped up with the fact that even if you don't want to go to a hospital to check your blood pressure, you can have home monitors, which she says are very, very reliable, and that if used correctly, they can actually give you a good reading. But do you think one needs to learn how to read these monitors?
Yes. Nowadays, I think it's now well, I say it's now common that everybody knows how to check their blood pressure, more especially the elderly, because we teach. You teach the person how to use it, because you can't just go and buy it and keep.
Definitely.
Yes. You definitely educate the person on how to operate the BP machine.
All right, but there's something called the white coat syndrome. I don't know if you've heard about it.
Yes.
And what is it, and how does it affect reading?
Okay, most times the white coat syndrome is just kind of, how will I put it, in a layman's language, right?
Yeah, definitely.
Okay, it's kind of something that, this is when, let's say, it's when you are nervous. Yes, maybe, let's say, for example, you went to visit the hospital and you went to see the doctor. So because of when you are seeing the BP machine, your BP will just rise because of nervousness.
So it's not real.
It's not real,
and it can affect the reading.
Yes, it can affect the reading.
Because after all, it's a machine and it's going to tell you what it sees, but not necessarily sometimes.
Yes, most times we'll tell you, just relax. Relax, it will read well. Yes.
All right, so let's get into the practical side right here on Inside Talk on the topic blood pressure. Are you at risk? You need to know, definitely. Let's talk about prevention. What lifestyle habits do you think people listening or watching right now can really put into their own lifestyle to help lower blood pressure?
Okay, I've been saying about this. Reduce the amount of salts, the intake of salts, stress management. That stress management is I think stress is most of our problems in Africa.
So you think that's the biggest factor?
Yes, that's the biggest factor. Then reduce the intake of alcohol. Try as much as you can to sleep well. Drink a lot of water.
Yeah, you also mentioned exercising.
Exercising,
regularly.
yes.
Okay, all right. But is salt really that bad? I mean, what's the big deal about
No,
salt?
the salt
Really?
is okay in the body, but when you take
Too much
of it, that's where it's a problem. Yes.
All right. Also, I also realized that in processed foods, some processed foods have high levels of salt, and people don't often realize how much hidden sodium is in canned foods and sauces. So you better be careful. So let's focus on stress. You mentioned the stress is a very big factor. Do you think stress alone, if I'm observing all of these things you mentioned, I don't take alcohol, I don't eat high salt, I don't do all of those things, but I'm stressed up. Do you think that alone in itself can really raise my blood pressure?
Yes. Yes, it can. Okay, let's use a scenario whereby after the day's stress, let's say you stress, you don't even have the time for yourself. You stress from morning till night, then from night till the next day, you be on your laptop, you stress. So it tends on bringing up the blood pressure.
Okay.
Yes.
All right. Oh, girl, listening right now, every one of you watching us, this is Inside Health, and we're talking blood pressure with Nurse Ijeoma Uche. And I think she's given us all the information we definitely need on blood pressure. So I'm just going to do a quick fire round. Just give me short answers. What's the best heart healthy snack you can recommend?
Healthy snack?
For the heart.
Okay, I'll recommend, we know the nutritional that we normally take.
Yeah.
I can say vegetables, fruits, yes.
That should be your snack. That's the snack. All right, so, but is coffee okay for people with high blood pressure?
I'll say no, it's not okay. Yes, it's not good because it has caffeine, which can boost the blood pressure.
All right, and then for the exercise, would you recommend walking or jogging?
Most times I recommend walking, because jogging, before you can jog from here to the other side, you might be tired. But when you are walking, you tend on walking a longer kilometer than when you're jogging.
And you're exercising at the same time, and you don't even, you're not keeping track of time.
Yes.
And how much water should we drink daily?
Daily, I take up to 5 liters in a day. Yes.
That's a lot. So we should stick to 5 liters? Or are we free to surpass 5 liters?
If your body can.
All right, so what about natural remedies? So people tell you, hey, do garlics, do hibiscus, do all of that. Do you think they help?
They don't. Yes, because I've never seen anybody that says he or she took garlic and the blood pressure just go lower.
So time to declutter your kitchen, right?
So please, yes. So stick to your medication that your doctor gave you. Yes.
Okay, Ijeoma Uche, thank you so much for sharing your knowledge with us today on Inside Talk. I know a lot of people are going to rethink now, how they treat their blood pressure, because I don't know what to say. Thank you so much for joining us.
Thank you very much.
Yes, my name is Faith Gavin, and this is Comfort TV, the channel. If you're watching this right now and you have not had your blood pressure checked in the last 6 months, permit me to tell you that this is your sign that you should definitely go check. It's fast, it's easy, and it can definitely save your life, okay? Like this video if you found it helpful, and drop your questions in the comments. Don't forget to subscribe to our channel, hit the notification bell so you get more updates when we drop health talks like this. Until next time, I would say take care of your heart.